Welcome to Community Voices with your host, Terrence Lachey. This radio roundtable features community, business, and religious leaders that discuss current events and topics that impact our urban community. If you would like to be a guest or if you have a suggested topic, contact the station today at 616-259-7342. Now, into the program.
Hello, everybody. This is Lee Stevens sitting in once again for Pastor Lachey on Community Voices here on Power 91.9. We always want to make sure that we, all times of the year, that we are committed to celebrating and also challenging ourselves and others in the community, but overall making sure that we make it plain that we want to know exactly what's going on in our community, challenge ourselves to be better, and work towards a more inclusive and equitable community that we surround ourselves because it is diverse. So as we start here in Black History Month, we want to make sure that we start off the right way. And one of the ways we can do it is holding ourselves accountable and then reaching for those ever glorious and ever challenging as well goals of diversity, equity, and inclusion, a subject near and dear to my heart because of some affiliations with some boards that I'm on. So why don't we just get right into it? Because this is the topic that continuously is going to have to be worked on. And one of the power persons that is doing it right here in our community at a very high level in an organization that is very important to our community and to the human body health. And believe it or not, we need diversity, equity, and inclusion in such. So today, I am pleased to invite and have on with us Dr. Rhae-Ann Booker. She is the Diversity, Equity, Inclusion Officer for University of Michigan Health West. And how are you doing?
I am doing wonderful, and I am happy to be here.
Did I get all that right?
You absolutely did.
Because I think a lot of times when we talk about this subject, it becomes a mouthful. And sometimes in this, hyper speed to information era that we live in, when you start spending more than 8 seconds talking about something, we kind of almost lose people. Well, we don't want to do that. We want to inform, we want to get them all into it. That's all a part of inclusion, making sure everybody knows what is going on and then how we're going to activate them, what is the concern, and then how we're going to activate them.
Yes.
So diversity, equity, and inclusion, and University of Michigan Health West is extremely committed to it. That's why they have you. And
yes.
Why we this is something this year round now, but in the month of February, of course, Black History Month, they are very dedicated to getting involved at a very high level in the community with regards to diversity, equity, and inclusion. So before we get into most of the stuff that's going on, if not all the stuff, I think we have plenty of time to do that in Black History Month. Where does your organization's commitment start when it comes to diversity, equity, and inclusion?
Yeah, so at University of Michigan Health West, our commitment starts with our mission, vision, and values. So you're going to see diversity, equity, and inclusion, the language, the commitment, the call, the challenge represented in the very language of our mission as we relentlessly advance healthcare that aims to meet the needs of all. And then in our values, inclusion is one of our top 5 values, and the values of an organization drive the operations. So it's very important that inclusion is named as a top priority. Also in our the mission, the vision, again, and the value. So the vision piece of it. Yeah. So I think that's very important because it's built into the very fabric of who we are and aspire to be.
And this commitment doesn't just something that I think for in some shape or form since the pandemic first started, that it's kind of illuminated, gone to another level with different things that happen in our community, and we won't go into that, but we know what they are. But their commitment, University of Michigan Health West, and the whole system as a whole, it's been way before that.
Absolutely.
So talk about where their commitment, kind of started from, if you can give that, and then what has taken them to the next level with it from your eyes?
Yes. Well, our hospital began in Grand Rapids in 1942 because of the commitment of two osteopathic doctors who wanted to have health care that put patients front and center. So what does it look like for patients of all backgrounds for us to be the priority? And for the care that's provided, our approach to demonstrate that you matter as a patient. Because of that, those doctors reached into their own pockets and used their own funds to start what was called then osteopathic hospital. And so I believe DEI began when the hospital started in 1942. However, the profile of the individuals that we were looking to serve at that time may have looked different in 1942 than it may look in 2023. So I'm glad that over the, whatever number of years, decades now, that patient, who we call our patients, who we commit to give access to quality care, is more inclusive of people of all backgrounds. So again, building upon our very beginning and steadily evolving as we come to understand our patient and the diverse patient population.
Yeah, diverse. And I mean, diversity in itself, you can't avoid. It's there.
It's there. It's a fact.
It's a fact. So, and then inclusion, for the most part, people want and good measure can get inclusion and get access. But the equity part always seems to be the portion where there is the constant and continuous struggle.
Yeah.
So I like that diversity and inclusion is a part of that, because that fuels the equity part that needs the most assistance and stuff. Where is, as far as University of Michigan Health West, the commitment to the equity part, can you shed some light on just a couple of things that really showcase how equitable they are?
Yeah. Well, first, let me clarify that at University of Michigan Health West, there is no inclusion without equity.
Right.
So in order for people to be able to fully participate, for people to have a sense of belonging, for people to know that they matter so much so that it manifests in the organizational outcomes that closes gaps between different groups, that's only going to happen through equity. So for us, inclusion requires at a fundamental level diversity and equity. So with equity at University of Michigan Health West, we're talking about fairness in treatment, giving access, especially to historically marginalized groups. And so a few ways that we do that. And it's interesting because if it hasn't been your lived experience, you don't even realize that these things matter.
Right.
For example, when you enter a healthcare facility, for some folks, they have to plan ahead.
Yeah.
Will the facilities be accessible? For some people, that's not a concern. They don't even think about it.
Right.
For some people, they worry about, will the physician understand their unique needs, understand their language, their culture?
Yeah.
For some groups, that's not even a thought. For some people, there are concerns about, will the color of my skin, my gender identity, my sexual orientation, my income level affect how healthcare providers would treat me? And because of those concerns, they delay or avoid healthcare, which can be a matter of life and death. And so, to address some of those concerns, number one, we have commitments around workforce diversity. So, who works for us and how we work together, and how do we ensure our staff, our physicians, are culturally competent. We also have language and translation services. So, again, for some people, you don't even think about, well, all the materials are primarily provided in English.
Mm-hmm.
And if you travel to another country where English is not the primary language and you had to seek out health care, think about the services that you would hope would be in place
Right.
so that you felt safe in that environment and that you're served effectively. We also have a commitment to developing the cultural competency of our physicians, our staff. We also have a commitment to health equity. So what does it look like for a healthcare organization to partner with community organizations to get at the root causes of disparities that exist between different groups and communities? And I'm so excited about that, the health equity efforts. So we have an Office of Health Equity. We also have, as far as our efforts, there's so many I'm trying to recall, employee resource groups. So how do you leverage the lived experiences of employees, people that we have the honor to work with within our organizations and to learn from, people who have lived experiences that are representative of the patients that we serve. So how do we tap into that lived experience and expertise to make our organization better and to better serve our patients? And lastly, I'd say one of our very important efforts is our strategic plan for advancing diversity, equity, and inclusion. A lot of organizations talk about this work, and it's a matter of talk. Yeah. It sounds good in the public square, but I believe organizations that are serious about DEI, they are strategic, just as they approach other organizational commitments. So we have a strategic plan where we are held accountable. We are measured, as far as the progress that we are making. So those are some of the ways that we are advancing equity.
I know, let me tell you, diversity, equity, inclusion, and she talks about a strategic plan, and that's, I just know any organization that you're totally committed to it and you're willing to do the work is work. It's another job. And just know that is, but it's important. Mm-hmm. You got to do it. And I don't want to characterize it necessarily as another job, but it's important work. Mm-hmm. And it's going to take more than just a weekend sabbatical to talk about this stuff. Yeah. It is a constant every single year, every moment, a function of being better, getting to those spaces where everybody is included. Everyone feels equitable. Mm-hmm. Everyone respects diversity. The culture competency that you talk about is so key in that. Yeah. And all of it is key. So I'm just so glad that I get goosebumps every time I hear organizations really committed to it. So shout outs to University of Michigan Health West. And of course, you, and I know that you're not the only one that stands alone in this effort. It is a team effort there at the organization. So great stuff. But listen, they also are very committed to our culture year round, but especially during Black History Month, as we're about to turn the corner on that and get right into Black History Month. Yeah. So let's talk about it. Where your efforts lie this coming February?
Yeah. So our efforts as a healthcare organization is, number one, we're going to be very supportive of community events. Mm-hmm. So in some cases, we are sponsoring events that are held in the community and encouraging our staff and physicians to attend those events. And so also within the organization, it's subtle things. It's like the screensavers on our computer screens, and where you'll see messages about positive messages about the ongoing positive impact of Black communities and Black culture on our community, on us as individuals, and beyond. Along with that, during Black History Month, our employee resource groups will be planning some events, and we're very excited about that because it gives folks an opportunity to attend events that are organized by their colleagues, where they can learn more about Black culture or experience our culture in creative ways. We also, during this month, are highlighting some of the efforts and the importance of addressing disparities, healthcare outcomes that continue to plague the Black community. And for me, everything I've shared so far as it relates to the Black community and what we're doing, it's great. I love that we're involved in the community. We're having events. That's great. The cultural immersion opportunities. But actually what excites me the most is looking at Black History Month as an opportunity to go deeper in our awareness of these disparities in healthcare outcomes, the difference in infant mortality rates, the differences in our access to quality care, the need for increased representation of Blacks who work in healthcare, and having those tough discussions around what's happening, what isn't happening, and further strengthening our commitment. For me, for a healthcare organization that's really celebrating Black History Month, that's where I hope they are devoting the bulk of their time. Yes, attending celebratory events, but primarily working to close these gaps in healthcare outcomes.
Yes. And she said a lot, but it's a lot, and you need a lot, especially during Black History Month. And they've already shown their commitment for decades, and they definitely want to highlight that during Black History Month and what they are committed to do for the community. Not just to say, hey, this is what we're doing, love us and stuff. No, it's way deeper than that. My sister, as a Black medical professional in Ohio, no, she's not an Ohio State fan. So everybody just chill. We talk about University of Michigan, but she's not.
Hey.
She's not an Ohio State fan. Okay, but I even where I feel like in some parts of Ohio, and we can say here in West Michigan, there's still a lack of Black professionals in the medical field and everything. And I know that both her organization, but especially yours, is working on that increasingly and everything, to expose young people to the medical field, in hopes that they one day be medical professionals. But I just feel like, getting back to diversity, equity, inclusion, that is not necessarily, and it's important to have the Black professionals because you want to, maybe probably see somebody that you can identify with culturally. But I also feel like diversity, equity, inclusion sits on the person, whoever your color is, to be intentional about those things so you can be welcoming to the same person, whatever their culture is. So I just wonder if you feel the same with that, because I feel diversity, equity, inclusion really comes down to granularly the person and not necessarily the skin color, because this is the only way we're going to get past all the roadblocks that diversity, equity, inclusion highlights and tries to effort past.
Yes. So, I think with diversity, and in particular, there we're talking about individual and group differences. When we talk about differences, unfortunately, for many people, they equate that word with the word differences with, in my opinion, deficits. Differences equate to negative. It equates to less than and lesser quality. And I want to turn that notion on its head. I would love for us as healthcare organizations, as communities, as individuals to see differences as just that.
Yeah.
They're differences. And they're not, let's remove the judgment. Not right or wrong, it's differences. And if we could start there, that would help us to see one another, to genuinely see one another, both the visible and the invisible. But unfortunately, I find that when we see one another, because of the negative connotation associated with differences, I'm already looking at, okay, they show in the research, when you see someone, although folks walk around saying, I'm colorblind, in like the first 15 to 20 seconds, if not less than that, there are three things that we think we see. One is race, gender, and then what do you think the third one is?
Okay, give it to me. It's okay.
So when you see me, when you saw me today for the first time, my race, my gender,
and your you got me on this one. I'm hard at thinking because I don't want to get it wrong. We all on camera.
You're all right. That third one is age. Our age within that we begin to like calculate and have thoughts that we don't even know we do it. It's unconscious. And we began to apply meaning to that, race, gender, and age. Along with that, the research is showing that increasingly we think we see sexual orientation and gender identity. So I can look at you, part of in that first 15 to 30 seconds, sizing you up. Yeah. Race, gender, age, sexual orientation, and gender identity.
And I wonder if that's a symptom, among other things, like tribalism. Like we make those assumptions because of our learned experience from who our immediate community is when we grew up.
Yes.
But I totally see that age. I don't know why I think about it. I'm in real estate. I should have known that. That's like legal, right? Anyway, but yeah, you know what? That you hit the one where I don't want to get off on the subject, okay? But it may be intertwined. But I feel like with some of the stuff you talk about, those assumptions of people have been a main contributor, if not the main contributor, to the fact that people are not open to knowing about somebody. And then when you start having conversations with people, you're like, oh, okay, you find out how much similar you are. Like, the old adage, like everybody puts on their pants on the same way. Well, some do, some don't. Some, but it's way more than that. It's more like, if I'm walking down the street and I have, street clothes on, like hoodie or pants or something like that, not to get off of medical or anything like that, but if I have an appearance, would you not know that I'm a Rhodes Scholar if you just assume that I'm walking down the street that something's up?
Right.
And so that is and then you find out that you may have run into the next Pulitzer Prize winner, but you didn't have that learned experience from that person or that ability to know that or be acquainted with that person because you assumed. And we know how sometimes assumptions end up in unfortunate ways. So I'm glad you brought that up because there's so much, so many layers to it. And I feel like, and this is one part that I was talking about work, y'all. It's so much to it. And if we could just spend more time in it versus dialed in on our, learned experiences and dial more in our shared experiences, I think we would get closer to what we're looking for. And, I don't know, in your lifetime or my lifetime or anybody who's watching this lifetime, will it happen? I pray to God it would. But I'm glad that you are doing the work. You're helping us understand that, and you're helping your organization further that. So
Yes,
I applaud you. I
Thank
give you your flowers for doing that work and stuff. And if somebody's watching, they might want to learn more about University Medical,
Okay.
University of Michigan Health West. Maybe they even want to be employed with them.
Yes.
Let's talk about it. Let's as we say, let's big up University of Michigan Health West. What commitment can they get from their prospective employer or someone who needs medical help or assistance from your organization? Give them the juice. Why it's the best.
Yes. I love that your verbiage of why it's the best, because I think that our organization, we're not the largest organization, and we don't aspire to be the largest healthcare org, but we do aspire to be the best. For those who recall when the hospital was named Osteopathic and then transitioned to Metro Health, now University of Michigan Health West, that transition, that affiliation now, our being a part of the University of Michigan Health System is major because it gives our local community additional, in your own backyard, access to state-of-the-art health care. So we don't have to travel all the way to Ann Arbor.
Right.
We can get that
Right here.
state-of-the-art, world-class care here. And so so when you think about the University of Michigan Health West, I want you to think about a hospital system where from the time you enter our doors, you know that you matter. We're not so super large that I think we are, people don't find us as overwhelming as some of the larger systems. And so when you enter our doors, I think you feel welcome. We really are intentional about our workforce diversity because we know that representation matters.
Yeah.
And not just having folks representative, but having their voices matter in who works at our organization, how we work together, how we shape and evolve our organization. So hopefully when you walk through our corridors, you will see people who look like you. And we're intentional about wanting to make that happen and ensuring that happens. With our organization, I want you to think of an organization that also pushes its staff, its physicians to get out, get in the community, and get involved, be visible, learn more about the people who are our patients, the communities they come from, volunteer in our community, help dispel myths people have about healthcare organizations and how they will be treated by healthcare organizations. You will find an organization that's working to partnering with higher eds and colleges and even K through 12 systems in order to build talent pipelines.
Yes.
So build the aspirations and firsthand experiences of children and youth so they will one day seriously consider working in healthcare. And lastly, and I think this is, two things. Our senior leadership. This commitment to diversity, equity, and inclusion does not start and begin with Rhae-Ann Booker. It is supported by our senior leadership and our president, Dr. Hahn, so much so that one of our top key performance indicators, so meaning one of the metrics, one of the some of the data that we track as an organization, one of the top priorities is speaks to DEI. And lastly, I will add that we are the type of organization where your voice matters as a community member, as a patient. When you come to our organization, we want you to have the optimal experience. So meaning when we walk into a healthcare organization, many of us are not there because we want to be there. It's because we're sick. We're vulnerable. Yeah. We're hurting. Mm-hmm. So at our most vulnerable points in life, we want to feel welcome. And so if you come to the University of Michigan Health West and that is not your experience, if you do not feel welcome or well cared for, we encourage you to contact our patient relations department and to give us that feedback. We take that feedback very seriously. We conduct investigations. We hold our staff accountable. And so you help us by giving us that feedback, both constructive and, and ideas you may have around how we can improve our care.
Well, I've met and talked with Dr. Hahn plenty of times and stuff. And a point of personal privilege and stuff, Dr. Hahn, you got yourself a superstar. Take care of her. All right, no, but I know you guys are taking care of business. That's the most important thing. You guys are taking not only taking care of employees and giving them the tools and the wherewithal to be a support to their community and the patients and everybody there. It's a team and family effort to diversity, equity, inclusion. And certainly you are leading a charge in a community that is, from my understanding, pretty much every organization across the board really wants to dive into this. And I'm so glad that you are doing that work for University of Michigan Health West. And thank you for Dr. Rhae-Ann Booker for joining us today from University of Michigan Health West. Community Voices, we'll be back with another great episode very soon. Pastor Lachey, we wish him traveling grace as he goes about this world doing the work of the Lord. And make sure that you follow us, all the socials, and on this YouTube page. Thanks a lot.
You've been listening to Community Voices with your host, Terrence Lachey. Community Voices can be heard every Friday at 12 noon. This radio roundtable features community, business, and religious leaders that discuss current events and topics that impact our urban community. If you would like to be a guest, or if you have a suggested topic, contact the station today at 616-259-7342. Until next week, let your voice be heard in the community.